it appropriate to come to this House to answer the question on the important announcement today. I've got to say, I always have the respect for the Secretary of State for Health, but I am really disappointed that once again this House has become second runner-up to TV news. Not acceptable. This is the game we're going to play. We're going to have to play hardball. Secretary of State for Health, statement.
Mr. Speaker, with permission, I'd like to update the House on COVID-19. Since the UK became the first country to approve a vaccine against COVID-19, which was almost exactly a year ago, we've been locked in a race between the virus and the vaccine. The success of our national vaccination programme has moved us ahead in that race. But now, with the new Omicron variant, we have to work even harder to stay ahead. Since last week, we've learned two things about this variant. The first is that no variant of COVID-19 has spread this fast. There are now 4,713 confirmed cases of Omicron in the UK. And the UK Health Security Agency estimates that the current number of daily infections are around 200,000. While Omicron represents over 20% of cases in England, we've already seen it rise to over 44% in London, and we expect it to become the dominant COVID-19 variant in the capital in the next 48 hours. There are currently 10 confirmed people in England who have been hospitalised with Omicron. It's vital we remember that hospitalisations and deaths lag infections by around 2 weeks. So we can expect those numbers to dramatically increase in the days and weeks that lie ahead. In preparation, the UK's 4 chief medical officers raised the COVID alert level to 4, its second highest level. This was done over the weekend. And NHS England has just announced that it will return to its highest level of emergency preparedness, level 4 national incident. This means the NHS response to Omicron will be coordinated as a national effort rather than led by individual trusts. The second thing that we've learned in the past week, Mr. Speaker, is that 2 jabs are not enough to prevent symptomatic infection from Omicron. But a third dose, a booster dose, provides strong protection, with analysis by the UK Health Security Agency showing a third dose is 70% effective at preventing symptomatic infection, and we expect the booster to take effect more quickly than the second dose. We're already running the most successful booster campaign in Europe. Over 4 in 10 UK adults have now received a third dose or booster. And Saturday was a record, with over 500,000 boosters given across the UK. But, Mr. Speaker, with the race between the virus and the vaccine so close, we must move faster. 2 weeks ago, we announced that we would offer every eligible adult a booster by the end of January. But in response to the Omicron emergency, and as the Prime Minister announced yesterday evening, we're bringing that target forward by a month and launching the Omicron emergency boost. We've opened the booster programme to every adult who's had a second dose of the vaccine at least 3 months ago to offer them the chance of getting their booster before the new year. So from this morning, anyone over 18 can walk into a vaccination centre, and from Wednesday, they can book online via the NHS website. The UK government will also provide whatever support is needed to accelerate vaccinations in Scotland, Wales and Northern Ireland. We have the jobs. The challenge now that we have the jabs. The challenge now is to get them into the arms. To meet our ambitious target, the NHS will need to deliver a record number of jabs. Until now, the highest number of jabs that we've delivered in a single day in the UK was over 840,000. We'll not only need to match that, but we will need to beat that every day. But we can, and we've got a plan to try and do it. We're opening more vaccination sites, including pop-up and mobile sites, that will be working 7 days a week. We're training thousands more volunteer vaccinators. We're asking GPs and pharmacies to do more. and we're drafting in 42 military planning teams across every region of our country. Mr. Speaker, this collective national mission will only succeed if we all play our part. Those who haven't had their booster should find their local walk-in and vaccination centre, or they can book an appointment on the NHS website from Wednesday. Those who have had their booster jab should encourage their friends and family to do the same. Those who have or have recently had COVID should wait 28 days from their positive result to get their booster. And to those who haven't had their vaccine at all yet, Mr. Speaker, I would like to say this. Whatever has held you back in the past, please think again and book your jab as quickly as possible. By acting together to get boosted now, we can protect ourselves against Omicron this winter. Mr. Speaker, I acknowledge that our national mission comes with some difficult trade-offs. We are redeploying NHS staff away from non-urgent services. This means that, for the next 2 weeks, all primary care services will focus on urgent clinical needs and vaccines, and some urgent appointments and elective surgeries may be postponed until the new year, while we prioritise getting people the booster. These are steps that no health secretary would wish to take unless they were absolutely necessary. But I'm convinced that if we don't prioritise the booster now, the health consequences will be far more grave in the months that lie ahead. Mr. Speaker, our Omicron emergency boost is a major step, but I'm not going to pretend that this alone will be enough to see us through the difficult weeks ahead. Because of the threat of Omicron, we are moving to Plan B in England, subject to the will of this House, meaning that we must use face coverings in indoor public places. People should work from home if they can, and from Wednesday, again subject to this House, you'll need to show a negative lateral flow test to get into nightclubs and large events with an exemption for the double vaccinated. Once all adults have had a reasonable chance to get their booster jab, we intend to change this exemption to require a booster dose. Even with Plan B, Mr. Speaker, we still have far fewer restrictions in place than Europe. I can also confirm, Mr. Speaker, that from tomorrow, fully vaccinated contacts of a COVID-19 case will now be able to take a daily lateral flow test instead of self-isolating. This is a vital way to minimise the disruption to people's daily lives and to avoid the so-called pingdemic. And I can assure this House that the UK has sufficient lateral flow tests to see us through the coming weeks. If anyone finds that they are unable to get a kit online, they should check the website the following day, or they can pop down to the local pharmacy and pick up a kit. And from today, I can confirm that the NHS COVID Pass is being rolled out to 12 and 15-year-olds for international travel, allowing even more people to be able to prove their vaccine status for travel where it is needed. From today. Mr. Speaker, Mr. Speaker, taken together, these are proportionate, balanced steps keeping the country moving, while slowing the spread of Omicron and buying us more time to get more boosters into arms. We're also taking steps to keep people safe in adult social care. And we know that, sadly, people in care homes and those who receive domiciliary care are more likely to suffer serious health consequences if they get COVID-19. So we're expanding our specialist vaccination teams to get more boosters to the vulnerable and those providing care. But even as we do so, we must go further to protect colleagues and residents from Omicron. So we are increasing the frequency of staff testing, and with a heavy heart, we must restrict every resident to just 3 nominated visitors, not including their essential caregiver. This is a difficult step, and I understand that it comes with an impact on physical and mental well-being. But we know that from previous waves that it's one of the most effective things that we can do to protect vulnerable residents. We are also increasing our workforce recruitment and retention fund with £300 million of new money. This is in addition to the £162.5 million we announced in October. The funds will help pay bonuses, bring forward pay rises and for the care staff, and fund overtime and increase workforce numbers over the winter. Mr. Speaker, I know that honourable members had hoped that the days of this kind of COVID-19 update were behind us. After our successful reopening this summer, it is not an update that I wanted to deliver. But the renewed threat of Omicron means that we've got more work to do to stay ahead of this virus. We can if we all play our part, and boosters are the key. We've achieved so many phenomenal things over the last 2 years, and I know we are weary, but it's on all of us to pick up, to step up, and do some phenomenal work once again to play our part and to get boosted now. I commend this statement to the House.
Can I suggest to the Secretary of State we could be a pop-up site for all the staff that work here to get them boosted? Can I now come to the Shadow Secretary of State, West Streeting?
Thank you, Mr. Speaker, and can I thank the Secretary of State for advance sight of his statement. Today, Mr. Speaker, we learned of the first death in the UK as a result of the Omicron virus. So on behalf of the whole House, can I send our condolences to the friends and family of that person who's lost their life. Their death sets this statement and the task at hand in context. It is a stark reminder that the pandemic is not over, that the new variant is a clear and serious risk to our public health, and of the urgency of getting Britain boosted and protecting us against this threat. Mr. Speaker, the Labour Party will always act in the best interests of our NHS, of our public health and of our nation. Having repeatedly called for the booster programme to be ramped up, we will give our full support to this effort. And we on these benches will make every effort to get the message out that vaccines are the best tool we have at our disposal to protect ourselves, to protect those closest to us, and to protect our NHS. The target of getting 1 million people a day their booster vaccine is unprecedented, and it may even prove impossible, but we applaud the ambition. If anyone can do it, the NHS can, and the whole country will be willing them on and will not knock them for trying. What people will not accept is the government moving the goalposts. The Prime Minister is now famous for over-promising and under-delivering. In his televised address last night, he said, and I quote, "People will have the chance to get the booster before the new year." But that aim is instead, as we've heard from the Secretary of State, is to offer the booster to every adult by the end of the month, meaning the delivery will wait until January or even February. Is the government now rowing back on the target set yesterday? If so, why has it changed overnight? And what hope do we have of achieving the level of booster jabs we need if the public and those delivering the vaccines are told one thing one day and another the next? The Prime Minister has got to learn to be straight with people because he is undermining public trust and confidence in the government and public health measures at a critical time. Can I also ask what discussions the Secretary of State has had with local authorities, GPs, pharmacies and other delivery partners who will be crucial to this effort? Then there is the shambles of testing. I must say, Mr. Speaker, I thought the Secretary of State might be living on a different planet when he described the availability of testing, because the government's website today states that home testing kits are currently unavailable, pharmacies across the country are out of stock, and even here in Parliament there are no home testing kits available from Portcullis House. No doubt this is due to a surge in demand ahead of the new testing requirements this week, but surely that should have been foreseen. And this is a serious problem. Those coming into contact with positive Omicron cases will not be able to follow the rules and get themselves tested on a daily basis. Those who require tests to undertake home visits risk being left short. Many others need them for work. So how does the Secretary of State plan to ensure there are enough tests in stock and available to everyone who needs them when they need them? And when will this be resolved? It doesn't appear the Secretary of State was even aware of the problem. Absent from the Prime Minister's address last night was any plan to speed up the vaccine rollout for 12 to 15-year-olds. On current trends, some teenagers won't receive their vaccine until February, 5 months after the government's initial target of October half-term. Children have already faced significant disruptions to their education. So will the Secretary of State update the House on the vaccine rollout for 12 to 15-year-olds? Will they receive their vaccines by the end of the Christmas holidays, as we've called for? And of course, Mr. Speaker, patients will be concerned by the news that appointments will be delayed to accommodate the booster rollout. There is no doubt that the booster programme is the right priority. If we don't get ahead of Omicron, the pressure on the NHS will be unbearable and the disruptions to people's appointments in the new year will be severe. But let's be honest, Mr. Speaker, the challenge is made so much greater as a direct result of the government's mismanagement of the NHS for 11 years. We went into the pandemic with record waiting lists, six-figure staff shortages in the health service and the care sector. So where is the NHS workforce plan? Where is the plan for recovery of elective care? And why can this government not understand that their continued failure to fix social care is piling even more pressure on the NHS at the worst possible time? And on social care visits, Mr. Speaker, can I ask the Secretary of State to think again about limits on care home visits? This feels like the wrong decision at the wrong time. Mr. Speaker, I'd like to conclude, if I can, with some words directed to the public. We realise on these benches that the Prime Minister has tested patience by asking people to follow the rules when Number 10 didn't. The Prime Minister's actions in recent weeks have undermined trust at a critical moment. So I say to people feeling let down or lied to that I do trust the Chief Medical Officer, I do trust the Chief Scientific Advisor, and I do trust the NHS. The Prime Minister might not lead by example, but the rest of us can. And we, the Labour Party, trust you, the British people, to do the right thing, to protect yourselves, to protect the ones you love, and to protect the NHS.